Now, in your practice, there are just so many different things and so many different types of chiropractors. Am I right in
Oh,
this?
yes.
Because I mean, I've been to one after an automobile accident, and I got to be honest, the only reason I went is because the insurance company said go. But then once I was there, I don't know, I was kind of a little apprehensive. Are your people that come in to see you a little apprehensive about?
Some are who have never been acquainted with chiropractic before, yes.
And can you describe, what happens when we would go, say we get in an automobile accident? There may be people out there right now going, I just got in a wreck last week and I'm not feeling well. What are some of the things that they can expect from a chiropractor or from the practice if that's what they need to go do?
An automobile accident involves a rapid spinal extension and flexion characterized by what is normally known as a whiplash injury. That's the most common form of injury from an automobile accident. And
I was going to ask you if that's really real, but it is real.
It is real. It's almost a cliche, whiplash, but it involves an impact which can be at a very low speed, even 5 miles per hour. But you have a 3 or 4,000 pound mass
Boom.
striking another mass like that, and you are an object within one of those masses, and that momentum is transferred through those heavy objects into a very light and flexible object, which is your spinal column. And even though seat belts do help stabilize your spine somewhat,
I had mine on, yeah.
they don't do anything at all for the neck, because your neck has to remain very mobile while you're driving. And so your neck is the most vulnerable part of your body to an automobile accident.
And that's where that term whiplash comes from, because you're whipping the neck.
That's right. There was a study done at Harvard probably 30 years ago or more, where they analyzed these physics of an automobile striking another automobile at 5 miles per hour, and found the acceleration of forces through the automobile into the neck is amplified greatly, even 200 times by the time it reaches the neck, in terms of the motion. That's very little motion occurs when 4,000 pounds taps 4,000 pounds, but the object within one of those can experience a great deal of kinetic energy.
I'm thinking of like maybe you've got a shaker bottle and a piece of ice in it. It's like just that quick motion.
Exactly.
Wow. So would you recommend that if someone has been in an automobile accident, they definitely go have themselves checked, even if they think, hey, I'm okay?
This same study cited that about 70% of automobile accident victims do experience some impairment from their impact.
70%?
Yes, and it may be only moderately or not at all noticed at first. There are 3 phases to any type of injury. The first one is the acute phase, where you feel the impact. You get a little swelling, feel like you've been bruised, a little bit of soreness, and that begins to subside in a few days, and most people think, well, I'm fine. Well, there may have been some soft supportive tissue damage during that acute injury, and the body will go on and begin to repair that damage by putting in new tissue to repair the stretched or torn tissues.
Okay.
And while this is taking place, this is where chiropractic care is so important, because the next phase after the body puts in the new tissue is stabilizing the spine. And chiropractic can help restore the spine to the normal alignment and normal curves while that is taking place, so that you don't lose those curves and lose the normal alignment after the injury.
Once they're gone, are they gone?
Once they're gone, they require some type of therapy or rehabilitation to reestablish,
and hopefully
it becomes
not
more
surgery.
difficult.
I mean, you hear horror stories about people who didn't do things and didn't take the steps, and then they go into back surgery. And I don't know, in your experience, I've always been afraid of any kind of surgical technology on the back. Every person I've ever known that's had it done has had problems for the rest of their lives.
It's pretty common. It is a last resort, and I don't want to minimize the help that can be attained from surgery, but it is a last resort, and it's rarely totally successful. It's a last-ditch effort, And much of these injuries and the results from accidents can be avoided by proper rehabilitation, therapy, etc.
And that's why our insurance companies now in this day and age, they didn't used to cover things. Now they realize that by using services from a chiropractor, you're saving years later that surgical bill.
Absolutely. An ounce of prevention. And
what's that old saying? An ounce of prevention, a pound of cure?
Absolutely.
Oh, I hear my mama's voice coming out of me now.